Good afternoon. This is Sandy Hicks with the Inside Story, and I'm very happy today to have with me some cohorts, so to speak, as they use the term today, from Manchester Community Health Center. And we're going to talk a little bit about all the many different programs and things that are happening in the community. But first off, I'll have my guests introduce themselves and what their role is. With me, I have Rich.
Hi, I'm Rick Swanson. It's a privilege for me, I think, to work at Manchester Community Health Center. I've been there about a year, and I'm a communications manager.
Okay.
Good afternoon. My name is Cecilia, Skerry. I'm the Patient Health Benefits Access Manager, and I've been with Manchester Community Health Center for the last 15 years.
Hello and namaste. This is Chuda, Niroula, also known as CM. I'm a medical interpreter, a former refugee from Bhutan, and a new American.
All right. Welcome and congratulations.
Thank you.
Join this country. Well, there are so many different things that are happening today compared to 20-some years ago when we first opened the doors. And it's exciting, as I've said before, for me to come into the clinic and see the translators busy at work, the different faces, the folks from all over, of all ages, because when we first started, we were more inclined to deal with mothers and babies. And now we're dealing with all ages. And so as a communications person, and you said you're fairly new, what's been kind of the new exciting thing about your introduction to the Community Health Center?
Well, one of the things I like the most about working there is it's such a diverse place. There's so many cultures represented there. There are a lot of new American populations represented in Manchester, and the staff at the Community Health Center reflects that and mirrors that. So it's like being in an international place. And another thing I really like about being there is it's a good cause. It's a bunch of mission-driven people that work there, and it's an important thing that they're doing. The mission is all about health care for everybody, regardless of ability to pay. And so that's enough to get you out of bed in the morning.
I remember the hours that we spent looking at mission and vision and wanting to stay to it and make sure that we were true to the mission that we started out with. And I'm happy to say that we really have become just as completely directed by it as possible.
Well, we're here standing on your shoulders today for the work that you did in years past.
Yeah, well, thank you. So, for you, what's been some of the highlights for you?
There have been many highlights of the health center throughout the entire time that I've been there. There was just all the changes and then the improvements and then the how we had actually grown into the community. We do, as Rick said, we do actually, accept new patients all the time. I can probably tell you that we had actually, for last month, we probably did about 500 and something new patients for 1 month that we actually schedule. That's people, they're uninsured patients, they're insured patients, they're people that come from all the backgrounds, and we have a lot of refugees too come into the health center. Just being able to be there and provide the services that those patients need and the language that they needed to, and also for us to be able to help them with health insurance so they can actually be able to afford their actual, office visits that they need, and they will be able to have more services. In my department, we actually help patients to apply for the New Hampshire Health Protection Program so they can have insurance. That's a new program that is here in the state. And we have been able to see the changes they have done in people that they were in our discount program because they had no other way to get insurance, right, but they couldn't get to all the actual care, the preventive care that they needed. And that has been a tremendous help to the actual patients to be able to actually improve their health and to do different things. I help them in their own language. I'm bilingual as well, and bicultural, so I do help all the Hispanic and Spanish patients there. So,
what is your history?
My history, I came from Uruguay, probably about 20-something years ago. And from the moment that I came here, I actually, probably within about maybe 7 years or so, or 10, I started working at the health center. and it was a really funny story. I was actually looking for a job in the city, and then I went to the health center, and someone says, "Do you speak Spanish?" And I said, "Yes, I do." "Oh, you're hired," she says to me. And she wasn't even the person that I needed to hire.
Right.
Even today, I'm still really in contact with that person. It's been great, and everyone that had actually worked or at some point helped in the community health center always have such a great things to say about us, and they're so impressed about all the
Right.
services. and
Spanish was
everything
the
we have
first
done.
strong language that we really began to
was.
work with
Yes.
our clientele.
Yes.
And then that has expanded so much. Why don't you tell a little bit about your background?
So, as I already told, I was a previous refugee from Bhutan,
Mm-hmm.
and now I work as a medical interpreter for Manchester Community Health Center. So, by now, I have found that we have a wonderful clinic, bilingual, bicultural staff. We have all the providers at least speak two languages, and if not, we have a fantastic, well-trained interpreter. So, I think we are giving a wonderful service.
Now, as far as your interpretation, did you do a special course in medical interpretation?
Yeah, I did 64 hours of interpretation training on medical health and 16 hours of behavioral health training, so which helps me a lot.
Right. And that's an important thing. For years, and I've lived in Manchester now 50 years, I can't believe it. My kids went to school there and my granddaughter. But when I would go to the hospital, I would be very concerned that years ago that they didn't have interpreters on staff.
Mm-hmm.
And so they'd grab somebody going by, and a lot of time it was the help, so to speak, that wasn't medical, and they would interpret. And the other problem was, and I saw this when I lived in California, is that often the children were asked to interpret, which is very inappropriate. And of course, not understanding health stuff, that was really dangerous. So it really, concerned me a lot, and one of the reasons why I pushed for when the Manchester, New Hampshire Minority Health Coalition was there as a partner, that we trained folks and we made sure people had that kind of training so that they could go and support the work that was happening at the community health center. And then the health center then built it into their own budgeting and took on the staff. And then we have how many languages would you say now?
Well, so there are 7 languages spoken every day through interpreters,
Right.
but Manchester Community Health Center can handle over 150 languages, depending on how much notice they have and
Right.
other resources available.
Can you name the 7 languages?
So Spanish,
Mm-hmm.
Nepalese,
Nepalese,
Spanish, Nepalese, Arabic,
Arabic,
Somali Maimai,
no,
Bosnian,
Bosnian,
Portuguese,
Portuguese.
and also in case we do not have in-house interpreter, we use tele-interpreter.
Exactly.
So we have like a lot of service which I give.
Mm-hmm.
It is not that we only have 7 languages in-house.
Right.
We have like
we have
more than
availability
100,
to whatever
yeah.
languages are necessary. And Portuguese is fairly new in our area, really. Spanish was a big strong one, and then Bhutanese, and then some of the African dialects. But now we recognize that even with Spanish, as you can speak to, depending on where you're from, there are certain expressions that mean something very
dialects,
different.
for sure.
I spoke a little Spanish, and when I was in California, I used a little,
Did
and then
you?
when I came back east, I was championing for that, and
Yeah.
I would tell people lots of times, Spanish from a Mexican and Spanish from someone from Spain is very different. And I said that's just an example. There are many,
Yes.
many, especially when you're talking about the Spanish language.
Yes.
And the same thing with French. My son learned French, and he said, I couldn't speak French. He said, if I was down in Haitian area, that's
Yeah.
very different than if I went to Canada, than if I
No.
went
Yes.
to France. And I think a lot of people aren't aware of that. And so it's really important that we talk about the fact that it's not just as simple as that. That's one of the reasons, as I was saying earlier, I don't text. I haven't learned the language yet. Yeah, it was enough to learn English and learn to speak it well. And now with the
Exactly.
texting that they do today, it's really interesting.
Yeah.
With spelling out the whole word, I'd probably use up a lot of time.
Yes.
But I understand how quickly it helps people get information.
It is.
And we're at an age of communication, and that's very important. With the technology today, everybody's in a big hurry. and I wish things would slow down a little bit myself. But when you talk about the communication pieces that you deal with, what are some of the major issues for you?
Well, I think Manchester Community Health Center sometimes seems like a well-kept secret for parts of the community. We have 16,000 patients, so that's definitely a large part of the community has already found us.
Right.
But I think one of our challenges is getting the word out about the good things that are happening there to create more awareness and engagement in the community.
Mm-hmm.
And I think we're doing that in several ways. We're using social media nowadays,
Mm-hmm.
which we wouldn't have done in the past.
Exactly.
And that's a way that people get their information nowadays and get engaged with the organizations that they're following. We do newsletters. Often the newspapers and local media cover stories about things that are happening here.
Mm-hmm.
For instance, recently we started a medical legal partnership. So where people have legal issues that maybe have are risk affecting their health.
Mm-hmm.
There are lawyers from New Hampshire Legal Aid that do hours at the Community Health Center, and they can help people connect up with the resources to help them with their legal issues.
And that's huge.
It is
Right.
huge.
And so, that's a good thing to get the word out about so people know.
Because just the fact of having a legal pressure can affect your health, and the added pressures
Exactly.
affect, someone with heart problems or hypertension or even diabetes. Just to name three of the, kinds of health issues that someone might deal with, which would be impacted when you're super stressed about some legal thing. And then making that connection. It is part of all the wellness piece that I'm founded about, that we as a community need to recognize and be sensitive to that. And that's, as you said, we're kind of a quiet secret in the community, but they are beginning to know where we're at and that we're located. And one of the nice things that I can speak to is where our new location is, and it's not that new. It's been there a while now. I used to be able to walk on Elm Street. Well, there's a hill now to go up and down.
Right.
So sometimes I'm not able to do that hill, but there's transportation that can be provided. And so that makes it even another accommodating factor. I think way in the beginning when we looked around the community to find a location where people could get to, access by walking or with public transportation, and that there was also adequate parking. And now we're in a location where that's not an issue anymore. And we've expanded so much and offer so many services. I know we have a new brochure. We can hold it up. I don't know that we'll be able to get a good picture of it. But
So we brought this in. It's a guide to all of our programs and services, and there are a lot. You can see there's a lot of pages in this booklet, and they make up everything from primary care to specialty care. As for instance, special children's programs for children with special needs. Chronic disease care like diabetes, like you mentioned.
exactly.
Behavioral health services, preventive programs, and social services and support, like you mentioned, transportation assistance
Right.
if you need it, and services for uninsured patients, which is a lot of what Cecilia does.
Yeah, I've just, as I said, I've been so happy to see the expansion of the services that we've been able to offer the community over the years, and that it's a place to come and go. I used to worry with the hospitals changing, what does that mean for people downtown in the area, to get services? And we talked about child health services, and now we have a West Side clinic. And you're at the West Side Clinic, basically?
I usually cover most of the sites, more often on main office Hollies, but sometimes I cover West Side, CHS, and Terrytown as well.
Okay. And you're basically housed on Hollis Street?
I'm housed on Hollis Street.
Hollis Street,
Yes.
right.
I have staff that works at the fourth location because we want to continue to provide patients that we cannot help them with insurance. It's still the sliding fee scale program, the discount program for the patients. So they will be able, if they qualify, they will be able to just pay a small nominal fee or co-payment for the office visit.
Right. And so we really have our location at Tarrytown Road, correct?
Right. So those are our 4 locations.
Right.
Our headquarters at Hollis Street.
Right.
And then we merged with Child Health
Health
Services,
Services.
a couple years ago, which you're well aware of and
Yes.
experienced with. And so that's where a lot of our pediatric practice happens.
Mm-hmm.
And then Tarrytown Road, as you mentioned, over by Elliott Hospital. And then in December, we went into a partnership with Catholic Medical Center to operate the West Side Neighborhood Health Center.
Yeah. And I think that really brings that connection full circle, because we have the Elliott and we have Catholic Medical Center. And in essence, we all should be working together.
Mm-hmm.
And I think at one point we were also using some of the services at Dartmouth, Hitchcock.
Mm-hmm.
So we really are connected well for everybody. With Child Health Services, we then also have a component where young people that have problems, especially problems, can connect with mental health.
Right, and I think that was part of how Child Health Services was
Initially
founded back
founded.
in the day, where I think they realized that in many cases it wasn't enough just to treat the medical problem of a kid. There might be basic needs needed to be met by the whole family, or mental health issues, and you had to really treat the whole family.
Mm-hmm.
And I think Selma Deitch, the founder,
Yes.
from everything I hear, was a real visionary.
Yeah,
in
very
that
much so,
area.
very much so. And she was very, very concerned about the needs of youngsters. And that when we took a look at society, if we don't really make sure our young people are as healthy as possible, our society is going to be pretty messed up. And when I look around today and see so many troubled young people out there, and I can say that as a senior, I wonder about what kind of health care they could have used, when they were coming along, that they didn't have available to them for one reason or another, or people didn't recognize the need. And that's a different thing when we really look at the whole person when they come into the clinic and what their needs are, and try to make sure they're connected up and the referrals are done so that they get the appropriate kind of care. You said you move around a bit, right?
Yeah.
So on average, would you say how many people do you end up having to translate for through in the course of a day?
Let's say 20 to 40,
Oh,
almost.
that can be kind of challenging, I imagine.
It would be, but we have a very fantastic service, and as I said, we have like 2 in-house Nepali interpreter. So I'm
Mhm.
talking about in average for 2 interpreter, we would.
Make sure you're
Yeah.
talking to the mic a little bit. Okay.
So we, as a 2 interpreter, we would interpret for 20 to 40 patients, which is nice service. As
Mhm.
Rick was telling that we have a nice service, we have a bilingual, bicultural community health worker, school project worker. So I think we are giving a very nice service to the people
Mhm.
who are in need. Because if you come to child health service, we have a bicultural, bilanguage community health worker who can help you in your daily basis. Like if a new American like me, we do not know very much things, and we do not know whom to go and consult. But if you
Mhm.
come to us, we have like legal assistant, we have community health worker, we have our counselors, so we can help in any way.
Right. Do you find that the kind of health issues that you maybe have been brought by some of you people who have come as immigrants and refugees are being addressed well in this country?
If I understand, like most of the Bhutanese people are having like challenges with mental health issue now, and it's a global issue nowadays.
Mm-hmm.
So I do not know about other people, but most of the Bhutanese are having this problem once they come to America,
Mm-hmm.
and I already told you it's a global issues nowadays.
Right. And I think that often people don't realize that when you come to a whole new place, I can't even imagine being all of a sudden in a whole nother universe, so to speak, and they have to try and adapt to and understand the culture that I'm being dropped into, coming from a long history of my own native culture, and then trying to just function, have a home, have a job, get an education, raise my children, and then address any kind of health problems that are coming along in that process. So it's a huge piece. So we just happy to have you as part of the staff.
Thank you. So, as I already mentioned, like we have Nepali-speaking people in a call center. We have 2 Nepali in-house interpreter. We have a Nepali check-in for west side, and we have a manager, site manager, who speaks Nepali. So, if you have any problem, come to us.
Mm-hmm.
Come to any of the locations. We have Nepali-speaking people who can help you. Not only to a Nepali, we have Arabic, we have Bosnian, we have Spanish. So we have bilingual, bicultural staff, which is already eager and ready to help people in need.
Yeah. Before you came to this country, what did you do?
I used to be an English teacher.
An English teacher. So that was very helpful coming to this year. So you've been speaking English for how many years?
Since from the time I know myself, our program was sponsored by Catholic Church.
Okay.
And it was implemented by Caritas under the funding of UNHCR.
Mm-hmm.
So I did my schooling when I was 6 years old, and I started learning English. But the thing is that my English sometimes is little broken because I used to speak British English, and they have American English here.
Yes.
It's quite different.
And often I speak about our American English versus what people say, oh, we speak English. And I had an English aunt who came here in the mid-50s, 1950s, and she immediately made me very aware that we did not speak English the same way she did, and that was the mother country and the motherland. So I often say to people, we speak American English. And of course, I think for a lot of people who come with a different language, our American English is very, very difficult to learn because we have so many words, depending on how you use them or how they're spelled, mean something different. So I can only imagine what it'd be like for people to come here and just barely learning the language or hardly knowing it at all. So I'm sure they're really, excuse me, reassured to know that there are people who do understand the native language and the native culture. So that's great. And the same for you. You came from Uruguay, right?
I came from Uruguay, yes. At the time that I came, it was the perfect time for me to come in. As you know, we have a lot of people that come from all backgrounds, and they come with different, visas. And then my father is actually a citizen, so in order for me to come in, I have to come in before a certain time. Otherwise, it would take longer. So I decided to just,
come on
in. I had a month before. It's supposed to be before my 21st birthday that I was supposed to be here in order for that to happen immediately. Otherwise, it could take 10 years for that to happen. So I said, well, I'm going to try it out. And if I don't like it, I can still come back. And yeah, that was probably 20-something years ago. And then I never returned to live there. So it was quite an experience. I had done all my schooling and everything else like that in my country. And then I came up here, and then I actually immersed myself in the community, not just with... There's a huge Uruguayan community right here in Manchester.
I remember Eileen Finney and I were close friends for many years.
You were, right?
The Latin Americans and I
Yes.
was drawn a corner from there.
Yes, so it's a huge community. And then I have some relatives, close relatives, that actually live here, that they're actually obviously from the same country. And then people kind of got together, and then they came to this, Manchester. People didn't know what Manchester was all about. and I think back in the days, they had actually offered jobs to, there was an owner of a textile that it was around here, and they couldn't find workers back 40 years ago. So they were it was a part owner with a textile down in my country. So started bringing all those people up here, and then there was this huge community of people from Uruguay that actually came
I mean, we
here.
had Pandora and we had
Exactly.
BB Shoes, and those were the
Exactly.
big industries then before technology came.
Yes.
And it's kind of sad that we don't have that anymore. I think about the
Yes.
difference that it made for our community. And as you said, a lot of people said, Manchester, where's Manchester? Oh,
What is that?
what is
Manchester, Connecticut?
Yeah.
Or is it
In fact, in the New England states, there is a Manchester in every New England state.
It is,
But
yeah.
New Hampshire in itself is a small state. And I think worldwide, a lot of people, except for, I think, political stuff, put us on the map in a
Exactly.
way.
If it
Like I said,
wasn't for
little
them,
old New
right.
Hampshire, you know, and then they began to find out that we are a cosmopolitan, really, of whatever is happening in the bigger metropolis. You know, we have the variety. I used to represent the state for domestic violence and sexual assault. And when I would go, they'd say, "You're from New Hampshire?" And I was like, "Yes." And I would sit on these different committees, and they said, the rural committee. And what's rural? We have rural here, you know, because I would meet people who went to do their health care in a helicopter. But I would also explain to them that we didn't have public transportation the same way either.
Right.
You know, and so over the years I've watched all that evolve. I think when we got some of the first money for HIV and AIDS, they said, "Oh, little New Hampshire, we'll give them a little bit of money, no big deal." So they found we had the exact same problems that they had nationally. And
Right.
so we've been able to really, as a state, and certainly as Manchester has a little bit of everything, show that we're able to deal with these things. People come here. It's a rich state. You know, we're close to Canada. We're close to the coast, you know. And there's a lot of beautiful things to see within the state. But the people here are really, really strong and hardworking and supportive. And I think it's been a good place for people to come as refugees, because for many years there were small settlements of refugees around the state in small pockets, which a lot of people didn't realize. It's just been in the last 10 years that people have recognized how much diversity we actually do have. Excuse me. And then, of course, we've had the celebrations in the summertime, and the People Fest and things like that, where people have come out and been able to really celebrate and recognize. And when I go downtown now and I go up and down, I miss the shops because we have malls, but we have all the different restaurants that are represented. And so, and the kind of health issues I think that you hear nationally, we deal with here in the state. And I think that through the Community Health Center, we're set up to really be engaging about anything that's coming up and how we can deal with it and what kind of referrals need to be made for people to be as healthy as possible.
Exactly.
And I think those
Right
are-
now, also based on the opioid abuse that is going on in the city, we actually have a couple providers that they actually do have Suboxone license, and they've been able to actually treat patients at the health center.
Yeah, and I think that's an important thing for people to know, because, as you
It
said,
is.
it's a big problem within the state and around the country, even more so
Yeah.
than one would ever have imagined. And I, as a therapist years ago, used to wonder about some patients maybe being over-medicated because it was easy for them to get. Often they would call and just get a refill on a prescription.
Yeah.
And so we had to be more conscious and sensitive to, that's not a good thing, you know. The people really need to be seen. And for one who has allergies, I was always very super vigilant about what things I could take and what things I couldn't, and what combinations of medications. And so it's always been really very important for me, especially as a person of color, to be a part of a medical network where all those different things were taken into consideration. I have a neurological condition where I make excessive spinal fluid. So there were some changes in my blood. And I can remember my first introduction to sickle cell when I was on the West Coast, and them engaging in that and trying to figure out. I spent 3 years out in San Diego as part of the university to find out the different kinds of things that are out there. And medically, I think we at the Community Health Center stay really on top of all those things.
Yeah.
I think with the diabetes programs that we have, which is huge, you know. And so I think one of the things that I'd like to see us be able to do more of, and I know we are doing some, is work with the kids in school.
We
So
are.
we do have a program.
We do have a program. We have quite a few employees right now that actually go into the schools. They go into the middle schools, and they go into the high schools, and then they do some preventive work, especially with children that they may have some needs, so they can actually work with them together. We have some community health workers as well that they do work in the elementary schools, and they actually help the parent. They become the bridge between the parent and the school to assist those children, especially the ones that they're part of our patients, to actually bridge whatever issues or whatever problems they may have. It can be a legal issue, we find out by going to their homes. We do home visits sometimes, and then we understand that better, and we can help the actual unit of the family, not just the patient. But we do meet those children and those teenagers at the school, and we help them to get into navigate through the system when they're having some issues, and help them to get where they need to get so they can be successful and they can actually go through that. Yeah.
Right. Before you came to the Community Health Center, what were you doing?
So I've actually worked for 10 years at a community health center in Arizona
Oh, okay.
before I moved here. So I learned a lot about community health centers nationally, and I think I got bought into the mission. And I can see how it's a great investment for a community, and it's a great investment nationally to provide quality health care for everybody, because a healthy community is a strong community.
Absolutely.
And if you can give people good preventive care and good primary care, you can keep people out of the emergency room by dealing with things before they come emergencies. And going to the emergency room, that's where it gets expensive.
Exactly.
Or
Right.
if you provide prenatal care to a pregnant woman, you can maybe keep a baby from going to the neonatal intensive care unit, but you can have a more healthy birth, and you can involve the whole family in the health of the prenatal pregnancy. So I think that's one of the things I learned about the community health center model. And I think another thing I learned is that the providers, doctors, nurse practitioners, physician assistants, and all the support services like behavioral health and social workers, and case managers, the team approach that they bring is pretty hard to beat. It provides great outcomes. For something like diabetes, it's not enough just to go to the doctor every once
Right.
in a while. A team approach can bring so much more.
Absolutely. It's one, like I said, over 30 years, and I can't even imagine if I hadn't had the team support that I've had over the years, where my health would be and where I might be, for that matter. So, the health experiences that you're being introduced to at the Community Health Center, are they very different than what you think would be in your home country?
It is different because I haven't known about primary care physician. I haven't known about all those things that we have to do it yearly, So before I come to Manchester Community Health Center, or when I was in my home country in refugee camp, I wasn't aware of all these things. But when I come here and start working, now I got chance to educate my community that hey, let's be healthy and keep the community healthy.
Exactly.
If you are healthy, you can keep New Hampshire community healthy, which is a great sacrifice,
Absolutely.
Because if I am sick, I can transfer sickness to everybody. So this time people are like, hey, I'm not sick. I do not have flu. Why should I go to a clinic and have a shot? I'm like, no, this is preventive method. So it is not home country. It is different from what we practice here. So let us take advantage of what we have now, because we already lack it for most of the life.
Right.
So my thing is that my goal is to educate community and educate myself.
Absolutely. And that'll help make all the rest of us healthier. As you said, people who are against getting a flu shot don't realize the transmission effect until we start hearing there's so much flu around. There are people who complain that they've had some kind of reaction, which could happen, but I think a lot of people say that but haven't had the reaction because they never took the flu shot. And as one who's been taking it for many years, I have been very fortunate, and I speak clearly about it to people that they should get it, and they should get it early. And pay attention, I have seen in my lifetime things that were chronic kinds of situations for children when I was growing up almost be gone. And then now I've seen in the last 10 years, many of them resurface. Whooping cough, scarlet fever, measles cases are back. Those kinds of things that people did take precautions to afterwards. We lived through them, but then they came up with inoculations that you could have
Right.
and booster shots to help later on. And so people need to be mindful of that. And maybe, oh, I had it years ago, and so it's not an issue. Well, I had scarlet fever, and so I went, and now I took the shot, so I won't end up with some additional problems.
Yeah.
But we have a pneumonia shot, which
do?
isn't, you don't have it every year, but you get it, and it is very helpful. For one who has bronchial asthma and spent in the earlier years a lot of time in and out of the hospital, it's just wonderful to know that now, since I've had that, the incidents have been so limited, you know. And so being a healthy community is something that we all can share in and benefit from. And I can imagine, as I said, when people come from a different culture and they say, okay, you need to do this, this, and this, and why, you know, until you realize there are exposures that could happen. And as you said, sort of like when they talk about sneezing, cover your hand. You don't want to spread it to everybody.
Right.
And just because of one person doesn't necessarily become sick doesn't mean that you haven't transmitted to somebody else. And so there are a lot of health lessons that can be learned. And so making the community health center a family place really gives us an opportunity for young people to learn to be healthier, and pregnant women, as you said, in the neonatal incidents are more limited than they used to be because of the early care. And that's when the community health center first started. We started on that level. And I guess well, you know, we also need to look at the conditions that older people have. And so now I look, and the whole family is being represented in our client base. And I see the translations that are happening and what have you. So when you were in Arizona, was it a large community health center?
It was about the same size as this one.
Mm-hmm.
They had more locations. It was a rural area,
Mm-hmm.
and they were based in Flagstaff. But they went out. They had a site at the Grand Canyon,
Mm-hmm.
and at the Navajo Reservation, and all across northern Arizona. But they had about the same number of patients, and the same size budget and that type of thing. And one thing that was very similar was it was a fast-growing organization, because there's a lot of need out there, and as fast as community health centers can grow to address that need.
Mhm.
Yeah, definitely.
Did you have also a variety of different languages being spoken that you needed to
Yeah,
address?
so Spanish was spoken, of course, in Arizona, and we had a lot of Navajo patients
Right.
and Hopi patients
Mhm.
primarily,
Yeah.
but nothing on the scale of what they do here on Manchester. I mean, Arabic and Bosnian, that's pretty diverse.
Yes. Yeah, and as I said, there's a lot of African dialects also.
Yeah.
So
They are.
that people are learning now. Yeah, one or two languages doesn't do it, No. But it takes establishing a level of trust in the community for people to come in and say that we really are here for you. We really do want to help you and make sure that you're healthy. And so establishing that trust with people who have different, even faith-based issues.
Right. Yeah.
And who do they look to and trust to say, okay, it's all right to go to these people because they're really sincere, they really want to help you. And that doesn't happen overnight. I realize that from living here and having traveled some, that we're really blessed in the fact that we have the diversity, but it's a challenge. It's quite a challenge. And I think that we've been doing a great job of meeting the needs.
One more thing that I wanted to add is that in order to also make the patient feel more comfortable as well, we also have providers that they speak also another languages. So we have a provider from Africa that actually speaks Swahili.
Mm-hmm.
So I had actually seen the interaction, and I have seen them going through the hallways, and then they see it, and they actually greet each other in their own language, and they just make them feel really at home. And that's kind of like the the atmosphere that we want to create for those patients to feel
Exactly.
really comfortable. We also have providers who speak Arabic as well. We have other providers who speak, Spanish and French and Bosnian as well now. So we had actually grown to the point that we do have interpreters and we need them, but we also have the providers speaking their own language, and the clients, the patients, they love to be able to speak with their own provider in their own language.
Absolutely, the level of trust that gets established is just wonderful.
Exactly, yes.
Yeah. Like you
So-
said, it seems almost more of an international place.
It is. It is an international place for sure. Yeah.
And I think it's important for people to feel welcome in your business or your organization.
Mm-hmm.
Then they're more likely to be happy there.
Right. Well, I hear you saying the
And,
things that you're learning. Right.
And the next thing is that, sorry for interruption, but you do not have to wait couple of days to get an appointment. If you are sick, call us. You will get appointment right on the very day, because we have like lot of providers who are willing to help our people, who are willing to help our community. So we have a lot of openings on this. So it's not that I am sick today and I have to wait for 2 to 3 days.
Yeah.
So instead of going to ED, if you call us, we are open like 24/7. We have on-call doctors. So it's very easy for the people. You just come to us. We are there to voice you, because Manchester Community Health Center really loves to help people who do not have English.
That's part of our mission.
Yeah.
And our vision is the fact that for the community, people will feel it's a safe place to come. We have hours for people who work, and so that people can be seeing somebody after the normal work hour that they would have, but there'd be somebody available to them.
Yeah.
And I know that if someone ends up, even if they have to end up at the emergency room, all they need to do is identify whoever their provider is, and that connection happens immediately.
Yes.
We hope that people will take enough good care that they don't have to end up that way. There have been a few occasions, so.
Yes, I'm pretty sure.
Yeah, but what other kinds of things would you like to share with our community listeners about the work that you see happening there and what we're about as an establishment in the community for health?
I think that, as Chuda was mentioning about the capacity that we can actually offer, the expansion of going to the different parts of the city, going to the east side, opening a new location on the east side. It has been very accessible to the people living on the east side as well, to be able to attend there. But we also have more providers, and also on the west side and downtown Manchester, and the children prenatal, we have so many more providers that will be able to actually offer sooner appointments to those patients. So we may have a patient that most likely goes to Hollis, but they call us today and they need an appointment. It can be seen by another provider, either on the West Side Clinic, or it can be seen on Tarrytown. It can be seen in any location that will be able to provide that service for them. So the expansion of hours as well. We also open from 8 a.m. until 9 p.m. So people that actually work don't have to miss a day of work like it used to happen before, by 5 or maybe up to 7. So now we expanded our hours to provide services up to 9 p.m. most days, and then also on Saturdays. So Saturdays is only by appointment that people will be able to attend, but people that work long hours and they can only have their physical done on a Saturday, they still can give us a call and we'll be able to help them. Or someone is sick and they call us the night before, our providers will be able to go right ahead and actually put the person in the schedule so they can be seen immediately by someone on that day as well.
And I know personally, when I've had an issue, when I've called, there's always been someone that got back to me pretty promptly.
Yes.
To find out what I needed, whether I needed to have an appointment or not,
Right.
what the suggestion would be best to deal with it.
Right.
And that's always been very reassuring.
Yes.
To know that
Yes.
that's a
And
possibility.
to have a live person as well.
Yes.
I remember when you started, but when I started and I was actually overseeing the front office, the call center it wasn't a call center, it was just one person. So for all of you, I used to have one person that actually used to take all those phone calls, and she used to transfer manually to all the other people and, arriving all the patients. And then we have grown so much that we actually have a call center that actually has up to 8 10 people. And then also with the nurses as well, we have more than one triage nurse, so that we'll be able to actually take care of the immediate needs of the patients calling us as soon as possible. So this pension has been amazing. I have seen the changes, and then it seems that they're actually for the better, and it's actually to improve the health care of the patients that we serve.
Absolutely, absolutely.
Yeah.
In the year you've been here, have you seen some changes that you saw that were really beneficial?
One thing I think that's really important is the partnerships in the city that Manchester Community Health Center is involved in. One of them that's doing a lot of great work is called the Project Launch,
Yes.
which stands for Linking Actions for Unmet Needs in Children's Health. And they're really focusing on early childhood development, which is so important.
Absolutely.
And they're working with partners such as the Easter Seals and the Health Department and the Police Department to provide services where they're needed and get the resources to the kids where they need them. And another program that just kind of grew out of that partnership is called ACERT, which stands for Adverse Childhood Experiences Response Team. And what they found was that some children had been witnesses to violence, like
Yes.
domestic violence, for example, and maybe the perpetrators and the victims of the domestic violence were getting services, but the kids who had been traumatized from it weren't. And so they found a way, they developed a model where they could have a team available right on the scene or soon after to find out how the kids have been affected and what they need. And it's a first of its kind program in the nation.
And it's been much needed. I was been an advocate for 50 years. And I can remember many occasions when we were starting through the Y, we had the response center and Emily's Place before we had even had Emily's Place. Situations, a couple that stick in my mind, where I was there to advocate initially for the woman. And then I recognized that I needed to switch hats and become an advocate for the child.
Yeah.
So I became a child's advocate. And I used to have to bounce back and forth when we had CASA. And I'd say, oh my goodness, we need to do better about this. Because a lot of people don't recognize the trauma that the kids have to face. And then the behaviors that come from that. You know, women learning to be submissive. You know, with young boys learning to be batterers. Or vice versa, for that
Right,
matter, on
yeah.
a defense level. And then psychologically, how you need to have them start understanding at a young age, because it's not normal. It's not how we should behave as a community. And so it's exciting to hear that we have this in place now.
Well, you're speaking as somebody who's definitely worked in that area on the front lines.
Yeah, so it's great to see, like I said, as a part of the partnerships that you mentioned at the community health center. It makes it so much where the community health center is the place that you go to regardless of what your need is in health, with it, even if it's psychological. You can start there, because that in fact can also affect your medical health. And for people to understand and be sensitive to that, because I used to get tired of hearing people, well, kids adapt, but you would watch the behaviors in school and how they interacted and realize they weren't adapting, they were acting out from the trauma that they've experienced.
Right.
And that's another, the schools is another area where there's a lot of good partnership going on that we're lucky enough to be involved in. The Manchester Community Schools Project is school-based, like at Goslar Park School and Beach School, and they're a resource in the community for families as well as in the schools. And I know community health workers from our community health center are involved, but also the health department is involved, and other agencies. And that's a great way to bring the services to people where they are.
Right. Yeah, and I think that's the important thing, because a lot of people don't have transportation and don't feel comfortable when you have remove them from the situation. I think you work best when you're dealing right in the familiar surroundings that they have to deal with and live with it every day. My throat is dry. Wait.
And
But-
I think nationally, Manchester's been recognized for that recently from the Robert Wood Johnson Foundation. Manchester got an award for being a healthy community for all this partnership.
Yeah. Yeah, it makes me really proud to have the connection and to see the growth and to see how many areas we've recognized we need to really involve, the partnerships, as you mentioned, and that it's just not one thing to say, oh, well, I go to the doctors and that's the end of it. It's more than that. And to know that there's a place that offers all the possibilities that in case you have another kind of situation. And I think the whole new legal piece that's available is another big thing that people don't take into consideration. And I'm excited to have been a part of the beginning and to still be considered as a client and an advocate for the work that gets done there. So the vision has really, become a reality of seeing that all those things are possible and we can do it in the community. It makes it safer for everybody,
So thanks for all the contributions you've made in the past and today, too.
Well, as I said before, I think it's important that people are aware of the work that is being done there and that it's an avenue for them to go and reach out to as a need, because this offers so much that has to do with our community wellness and health. And so thank you all for the good work you're doing. Continue.
Thank you, Sandy. Thank you for having us too, and it's been a great ride, and thank you for actually helping us to actually be part of what we are today. I think you had a great vision from the beginning, and you were a pioneer and trying to request new services. So we thank you as well, because I think that everybody puts a little bit forward, and then it gets to a point, things are happening, and then we get to the point, and then the vision that you had actually seen from many, many years ago. We don't want to say how many, but we have probably got to that point now, and it takes time.
It does take time, and I think that's another thing we need to recognize with a lot of things that happen, that it doesn't happen overnight.
No.
And it takes little steps for it to be a positive thing and to be a lasting thing.
Yeah.
I think often if you do things too quickly and you haven't considered all the other pieces, it doesn't work out well. And so gradually you recognize and you draw those things in, and everybody then makes a commitment to be a part of the whole. And that's what I see has happened with the work that has happened with the Community Health Center and what we offer the community. I just want to, as I said, take any opportunities I have to remind the community that you're there and that what you offer for everybody, regardless what your
All
situation
ages.
is,
Yeah.
And financially, age, background, whatever.
Background, race, ethnicity,
Ethnicity,
gender,
exactly.
anything. Yes.
Yeah, it's a healthy place to be.
Yeah.
And healthy place for us as a state to have an organization. I think we are a model for a lot of places. So hopefully we'll continue to grow, and people will begin to really recognize how important it is. I think, especially in these days when there's so many different problems going on, like we mentioned, not the opioid problems and trouble with kids in school, and knowing that that's a part of a whole other problem that we need to deal with and address, and to keep our communities safe and healthy emotionally and physically. And then there's the spiritual piece of it too.
Everything, yeah.
Well, and if people want to find out more about Manchester Community Health Center and our 4 locations, we've got a redesigned website that I think is pretty good to look at. It's mchc-nh.org, and I'm sure you could get it by searching for Manchester Community Health Center.
I was going to have you do that and do our phone number.
Yeah, and the phone number is
626-9500. Or also you can find us on Facebook. LinkedIn, and Twitter.
Okay. I think we're up to date with all the new
Yeah.
technology.
We're
We
getting
are.
there, yeah.
Yeah. And remember that there is someone available 24/7.
Yes, and don't wait until you are sick. Come, have your primary care physician, and once you are ready to have your physical or any kind of things, we are ever ready to help you.
Yeah. We've talked a lot about dealing with problems, and not as much emphasis has been put on, as you said, the primary care, to go in first to make sure you're healthy and what your needs are, and then to build and stay on top of that. You know, we don't want people, just as you said, to show up when they have an issue. We want them to initially have an established health plan and then build on that to stay as healthy as possible.
Yeah.
So,
Let's remain healthy and keep the city healthy.
yes. And we'll make for a healthier state. Yeah, because I think we're a good representative of what can happen, and other people can look at that and what we have to offer. Yeah, but I can't thank you all enough for coming in.
Great.
Mention once more what the website is, please.
mchc-nh.org. And our phone number again is 626-9500. And check us out on Facebook.
Yeah.
And you said also
LinkedIn, Twitter.
and Twitter also.
Yeah.
All right. Thanks again. And with that note, this is Sandy Hicks signing out for The Inside Story. Until the next time. Okay.